We are live, sir.
Okay. Good evening, everyone. On behalf of Dr. KK's Heartcare Foundation of India, I welcome you all to our 87th weekly webinar. These sessions are primarily conducted to educate the little children on different aspects of health, wellness, and environment. And thank you all for joining us today. The topic for today's session is the importance of right movement and good posture. Actually, technology has been a major impact on our lifestyle in the recent years. Our continuous use of gadgets by both young and old has resulted in a very sedentary lifestyle. This has a major impact on our body, which I think needs to be looked at. Now I'd like to introduce our speaker for today, Dr. Anjali Agarwal. She's a consultant physiotherapist and a lifestyle consultant, and also a co-director of Long COVID Physio. She has been highly instrumental in conducting programs for children in schools for promoting good posture habits. Before we start, I would also like to extend a very warm welcome to all our co-hosts for today. Mrs. Aruna Shivraj, Principal, Himalaya Public School, Rohini; Ms. Ritu Mahajan, Supervisory Head, DLDAV Model School, Pitampura; Mrs. Charu Dhingra, Coordinator, Ramjas Public School, Anand Parbat. Thank you all so much, and to all the teachers and principals for joining us today. Can I now invite Mrs. Aruna Shivraj to say a few words?
Thank you so much, sir, for your warm welcome. Very good afternoon to everyone. Good afternoon, sir. I welcome you all the eminent person and my children and teachers. I welcome you all once again. My special welcome to Dr. Anjali Agarwal, madam, who is a speaker of today's session. So just a little bit introduction of Dr. Anjali Agarwal. Dr. Anjali Agarwal, consultant, physiotherapist, and a lifestyle consultant, and a women's health specialist. Dr. Anjali has been trained and has worked in India and in the UK with the NHS. She is licensed by the Health Professional Council and as such has gained valuable education in advanced therapies during her tenure of work in England. If I start read her achievements, the evening is not enough for us, right? So let us gain knowledge through her wisdom, whatever her experience. Let us learn something so that we can improve our good posture. And before that, I just convey my regards and gratitude to our KK Agarwal sir. I didn't meet him face to face, but I met him virtually, and his sparkling inspiration through his wisdom was memorable and is unforgettable. So once again, I welcome all the eminent person to this session. And we are waiting for Dr. Anjali Agarwal's wisdom. Through her wisdom, we will learn something. So welcome you, ma'am. So please carry on.
Thank you, ma'am. Thank you, everybody here. And it's a wonderful evening today, and I hope all of you would.
हमारे और भी co-host हैं, ma'am.
Yeah, just 1 second, Anjali. Thank you, ma'am. Thank you so much for your this thing. And may I now invite Mrs. Ritu Mahajan to say a few words.
Sir, thank you, Ashish, sir, so much for inviting me to the platform, and heartfelt gratitude to the KK Agarwal, Lung and Heart Care Foundation. And see, Dr. Anjali, we are anxiously waiting for you to hear the pearls of wisdom. And before we commence with your session, I would like to say a few words on the topic. See, children, today, since you are also a part of the session here, so many times you must have heard the words, sit up straight, don't slouch. I'm sure we have all heard these words of scolding more than once from our mothers or teachers. And mothers and teachers seem to be the best. The COVID pandemic has indeed taken a toll on us, and it has not only damaged our country's economy, health, education, but the most affected have been our children. It has brought with it a lot of restrictions on the movement and confined children in the four walls of the houses. Be you are sitting in the front of the television sets, or you are sitting in front of your laptops, or mobiles, or computers. The long, exhausting hours in front of these devices, devoid of any movement, has certainly given to, several issues have cropped up, physical and mental health issues. And sooner the children and the parents realize and are sensitized about it, so the better it is.
Ma'am, you are muted.
Chance, it is a, yeah. So see, medical researches have also shown that good posture along with the psychological factors like positive memory, the good confidence, cognitive stress, so energy, etc. These are all associated with our right movement and good posture. A study that has been conducted through health psychology has also included that the way we all sit during our work hours or during our study hours, it can also affect our mood. It can also affect our ability to take certain decisions. If we have a relaxed posture, if we have a relaxed movement, it will, activate the right side of the brain, and therefore it is essential to practice it every day so that you do not face any health problems. If you maintain good postures, obviously you won't be having headaches. That will be well explained by Mrs. Anjali Agarwal. Then you won't be having much of strain on your back. You will be having, or the easiness in the breathing will be there. So these are all some of the good points of good posture. But on the contrary, if we are not having the right movements, if we are not having right posture, it may have sorry, I got muted. And it can lead to poor digestion. It can lead to, carpal tunnel type of a syndrome where there is a tightening of the muscles. So we have to avoid, and it is mandatory for the children to maintain this. So we look forward to Mrs. Anjali's session. And Mrs. Anjali, this is the need of the hour because we have more or less, we are having a sedentary kind of a lifestyle where we are sitting and the children are confined in the walls and they are not having much to go outside or to play or to have movement. So looking forward to your tips so that we are benefited by your enriching session, Dr. Anjali. Thank you so much. Over to you, ma'am.
Thank you, ma'am. Now can I invite Mrs. Charu Dhingra to say a few words?
Thank you, sir. A very good afternoon to all of you. On behalf of Ramjas Public School Day Boarding, I extend a very warm welcome to the dignitaries and the participants. It is indeed an honor and a privilege to be a part of the session. Dr. K.K. Agarwal had been the guiding light for all of us, and with his invaluable guidance, he had relentlessly enlightened one and all and imbibed into us such kind of absolutely the desired strength and positivity that we wanted, and that actually helped us to sail through those traumatic times. I would especially like to appreciate and thank his loving daughter, Ms. Naina Agarwal, and her team for upholding her father's ideals and ceaselessly carrying on the legacy and just going ahead and working so, putting in so many efforts to actually go ahead and ensure that the show must go on and just living up to his ideals. The importance, the topic that has been given today's topic actually, as it has been pointed out by Ritu ma'am also at length, that it really holds a lot of relevance. And it is so important, keeping in mind the kind of problems we have been facing during the pandemic times and how our children and the adults have been sitting glued to the gadgets. Attention actually needs to be drawn and awareness needs to be built, keeping in mind the current situation, the scenario, And I feel, I mean, once we build up this awareness, a room for conscious correction can be created. And once conscious correction comes in, that is something, I mean, self-correction, I'm sure, I mean, all of you will agree that there's nothing better than self-correction. And once that comes in, that's the best thing. And we are really, really fortunate to have Anjali, Dr. Anjali with us, who's, and we look forward to her to enlighten us on this particular pretext and give us the guidance that we have been looking forward to. Thank you. Thank you. And my best wishes to HeartCare Foundation for carrying up this good work. Over to you, ma'am. I mean, we are really looking forward to your words.
Thank you so much.
Thank you so much, ma'am. May I now invite Dr. Anjali Agarwal to start the presentation.
Thank you, Mr. Ashish. Thank you, everybody here present for this talk. It's my special honor to talk on behalf of the HeartCare Foundation on a very important topic of posture and healthy movement. We know that we were we kind of emerged from being primates to become human beings who stood on his two legs. But we were a four-pedal animal previously when we kind of evolved into being a human being. And now we have gone back to sitting down on a chair. We are no more bipedal anymore. We are sedentary, we are glued to a chair, and that has caused a great pandemic of obesity, pandemic of pain, pandemic of mental disorders, because we are so glued up inside our homes. So today's topic, let me just dive in through, and let me just share my screen. Yeah. I'm doing an F5. Is it happening? F5, yeah. So what is the importance of a healthy movement and a good posture? We all know, as everybody here in the talk have mentioned, that we have always been asked to sit straight. But is just sitting straight enough for us? We keep telling every person in my clinical practices, your posture is not right. You have pain because your spine is not right. You have pain because your neck is not right. But there's a lot of things which we really need to govern and rule on. So let's dig deeper into the topic. So ma'am has already given a lot of introduction regarding me, and I do a lot of work on physical literacy. So promoting physical literacy is one of the prime goals for all of us now. I know that we are socially distanced, but we should never be physically literate enough to not move our bodies or not handle our pose and posture and movements in a rightful manner. So our day should start with blessings from the sun, movement in the sun, getting out into the sun, and getting our body some tender loving and care through the movement, because every movement is the medicine, is the best medicine which our bodies are adapted to. And movement is the best medicine when it comes to taking care of your painful joints and any other issues, which is becoming a hot topic nowadays. Now, it's very easy to say that good postural habits in children is a fix for problems that is caused in adulthood. So in this picture below, we see the kids are sitting as and when and however they want to sit. They don't have their legs aligned, their hips are not sitting in one position, their hands and shoulders are all kind of misaligned to one side of the body. One is slouched forward, one is slouched forward. Now, as I said, our bodies are like earthen pots. The shape which we build up right from the beginning, when the child is growing up, what are the growing up years for the child? The age of 6, 7 till the 12 is the tender age when the spine forms and develops. Now, when the spine is developing, whatever shape our spine takes in that developing age, the spine will form, and that will be the spine which we will live forever as an adult. So as a physio, I see a lot of small kids, age 6, 7, during the pandemic, having bony structures which are getting deformed because of the lack of sunlight, because lack of movement and because of continuous sitting on their desk and chairs without any movement. Your bones are more probably better if you move and stand and bear the weight on those bones. But if you're not standing and bearing weight on the bone, because bone is a weight bearing joint tissue, more calcium gets deposited, more phosphorus get deposited only when you bear weight on those bones. But the shape which you have given to your child, given to your student in the young age, that is the kind of spine and the posture the child will carry forward in the coming years. So we should be mindful of the way we look at anybody. We should become the advocate, or we should become the ambassador for good posture for each and everybody around us, in front of us, behind us. Now, in this, you see a postural control. If you see the gentleman standing in this pose, you'll see somebody is standing really stooped as a sway back. Somebody's having his chest real forward and his hips are raised behind, which is called as the lumbar lordosis. We are standing like a lord. The word lumbar lordosis comes from the term called I'm standing like a king, I'm standing like a lord. So my chest is all out, my hip is all back. This creates a big compression or the hollowness in the spine. Many times, this kind of postures are being seen gradually developing in the kids of today's times because they get very short hip flexors. The muscles right in front of a thigh is called as the hip flexors. These muscles, if they become shortened, they can pull your pelvis in a wrong manner. They can pull your spine in a wrong manner. And because of this, people will complain of a lot of pain in the lower back. Now we tell, okay, I've done everything possible on earth to get myself pain managed. My pain is not managed by the pill in the box. It's managed by how I stand, how I move, how I sit. The simple pill is the right movement. How I'm standing here in this posture is this child is having a stooped posture. His chest is compressed. Now, many times you'll see this child will not be able to breathe. He'll have issues with breathing discomfort, mainly because their chances of getting asthma, chances of getting breathing disorders increases if you have a stoop posture. Everybody of you present over here, try to do this example, like try to stoop yourself and try to take a deep breath. It's very difficult to inhale with a chest which is tight and compressed rather than a chest which is open. Now, when you sit in an upright manner, you draw more attention from everybody around you. You look more positive, you look more smarter. So for smarter postures, for setting out an example to the world, to have a mark in the world, your posture plays a very important role. An important role a posture plays is in your health, in your development, in your growth, in your mental growth and ability. Because if you have stoop posture, the blood supply to the brain, the blood supply from the neck to the brain is also hampered. So all of these issues causes a lot of issues with our hearing systems. So what do you mean by sensory, visual, vestibular? So vestibular apparatus are systems in your earlobes which help to balance your bodies. And the vision, the way we look at things, the way we view things, and the way we drive also depends on our visual, sensory, vestibular balance. All these gets very compromised if our postures are not right. And altogether, not to forget, is a muscular system. They all work together. If I don't have a posture which is right, my muscles will become shortened or too tight, and they will have a saga of pain syndromes coming in for them. So the best thing to important is the posture where you see the person standing really straight. So when he stands, try to stand towards the wall and try to put your hand at the lower back. If your hand is easily sliding in, we really need to work on your postures. Right now, all of you sit on your chair. Okay, let's do a mini activity. All of you sit on your chair. Try to go as back as possible to the back side of your chair. If you see that your lower back is not able to touch the chair and you're able to easily slide your hand, that means you are in the second picture, whereas you have increased lordosis. Now, every time when you're sitting for long hours, you'll tend to develop something as thoracic kyphosis or thoracic lordosis. These are the two things which we should avoid. And how you can avoid, I will be kind of guiding you through this movements. Now, this is a very cute picture here. We see a girl and a boy sitting. Now, everybody tell me here, it's a very interactive session. So all of you tell me which person is having a good posture here. Which child is having a good posture here?
Girl.
Does anybody wants to answer?
Girl, of course, girl.
Girl?
Yeah.
Very good. Why so you think is the girl having a good posture here?
Because she is sitting straight and keeping her book in some distance.
Right.
So
And
maybe
what
that
about
is the
the
reason.
boy? What about the boy? What has gone wrong there?
Even he is not sitting straight and he is bending his neck. So maybe he will get a problem in backbone. And he is
Yeah.
keeping his book very close to his eyes. So
Correct,
maybe,
correct.
yeah,
Very
so-
nice.
Lines
Right.
curved in the voice case.
Right. So, like, how do we detect the poor posture as teachers, as students, as friends, as colleagues? Is our neck and our eyes should look at the screen of anything, which is your book, which is your laptop, at an angle of 10 to 15 degrees. And our neck should never go off our headline. So this is my earlobe. Okay, everybody touch your earlobes. And earlobe should be resting on your shoulder, right? The moment my earlobes goes away from my shoulder, my posture is compromised, right? This is a simple tip I give to all of you. Go and do this kind of homework in the house with everybody in your family today. Observe how everybody's sitting, see how whatever everybody's doing, and you can see that people's postures are really not right when they're using their screens and all. Now, this is another good picture here. What is a poor posture? Why do you think this? Here we see a poor posture where the neck is bent forward. What will happen in this case? So, lot of times, lot of parents come and tell me that my child is very fatigued, very tired after the school, very tired. Even though he's in the house, he's always very tired. Why? Because the way he's sitting is his earlobe is not sitting on the shoulder. And as a result of that, his shoulders go forward, his chest cavity squeezes and shrinks. And because of that, he'll have poor focus, lot of neck pain, back pain, lot of mood swings. He'll be very irritable. All of us, we can find out those kids are not able to concentrate and they'll have a height reduction. So a lot of kids during this pandemic say that, ma'am, I'm not gaining height. Why is it so? Now the answer lies the way we sit, the way we stand, and the poor psychomotor skills. Psychologically, we see a lot of children are having a lot of psychological outbursts. They tend to cry very easily because your posture is the foundation for good health. It is a foundation for good immunity too. Why I say so? Because if your chest is open, you breathe well. And when you breathe well, oxygen, your breath is the mother of all good health. So if your oxygen is good in your lungs, your posture is good, the blood flow to the neck is good, person is having a good posture. Now, how will you see the good posture while standing? The girl is having his earlobe, shoulder, elbow, and the wrist all in one straight line. And her knee and her ankle, they fall in the one straight line. So when you stand up, all of you observe now. All of you stand up now and observe the ear, your shoulders, your elbow, your hand, your knee, and your ankle. See for yourself if you can find that everything is in one straight line. And if it's not in one straight line, just write it in a piece of paper. We'll take your questions at the end of the session. Yeah, all the children, please do this. All the parents and the teachers, try and understand what's happening here and see for yourself how everything is falling in alignment for you. Right? Yeah, so if you can just imagine the earlobe, the shoulder, the elbow, and your hand, and your knee, and your shoulder, and your ankle. They all should come in one straight line. If this is what you are able to do, 90% of the times your postures are good. There are no chances of having any other issues related to postures. Now we see our couch potato syndromes nowadays. Every child I see is sitting in a very cozy sofa with a support at the back, but his spine and neck has gone for a toss with a gadget in front of it. How much time do we spend in front of the gadget? How much time do I use on my, PlayStation? It's very important for every child. Try to minimize the amount of time you're spending with your gadgets. Spend with humans, spend time with your family, play around, have some movement which is more active and more in, like it gets your heart to work, not just seated there on your sofa. Because you see, a beautiful spine which God had gifted us. Now just look at the spine, what it is becoming. And as I have told, I'm repeating again, whatever shape I give to my spine from the age of 6 years to the 12 years will determine the future of my spine in adulthood. So 6 to 12 years is the tender age where your spine will take the formation. So make sure that you are not doing anything which shapes it in a wrong way. Now for adults, for teachers and teens, and for students who are very small, how you sit in front of your PC is very important. Now the key word here, remember, is the 90-90-degree rule. Now the gentleman is having his eyes at 10 to 15 degrees with the laptop. Now with the earlobe and the shoulder and the elbow in one straight line, he makes an angle of 90 degrees with his wrist to the shoulder joint. This angle is very important when you are using your keyboard to type, or you're using the mouse to use the computer screen, or you're using a cursor. Now, when he's seated on the chair, he's seated with an angle of the hip to the knee, and the knee angle to the ankle joint is 90 degrees. So the rule of thumb is 90, 90, and 90. So what is the 90-degree angle? Shoulder to the wrist, 90. Body to the lower back to the knee joint, 90. Lower back to the ankle, this is 90. And he's having a support at the lower edge of the ankle. So if you're too short in height, if you're too tall in height, you really need to adjust your chair height, your table height. Small children and young children should look at the postures which can be applied when you sit in these positions. Always have your foot grounded on the ground because it supports your spine. Otherwise, a lot of pressure will go from your lower back, which will become very, very stressful for your joints of the spine. Now, the common areas of pain which I see in children, in adults, earlier I would say was the old 30 was the old 50, but now I see the young 30 is the young 15. So like the 15 to 12 years of kids have a lot of pain in the neck, in the shoulder, in the elbows, in the hip, and in the wrist. Constant typing, constant studying online, not having any movements puts a lot of repetitive stress on these joints where we see these red joints. Now, these are the joints which are constantly under pressure when you are working non-stop for long time or studying for long time. So we really need to have a mindful approach to how we can minimize the damages of long sitting, which has been happening for these painful joint areas. Now, this is a very beautiful picture. I usually talk about it a lot, many times. What is a text neck? I also call it the turtleneck. Nowadays, all the young children cannot lift their neck to the top part of the spine. All of you try to look yourself up to the ceiling. See how much your neck can go up. As much as possible. At a point, many of them cannot go and lift it up. And as a result, what is happening is called as the text neck or the turtleneck. So our spine or our angle of the neck angle should be about 0 degree. So when the angle of the neck to our spine is 0 degree, the amount of pressure which goes on the neck is nothing, is almost 0 pounds of weight. But as we increase the angle of 10 degrees to 20 degrees to 30 to the final degree, our neck, spine, everything is getting compromised. Now, as a result of that, you see the spine is getting curved here. This is happening in the case of all the young children now. As I said, a spine between 6 to 12 years is as like a smooth clay pot. You can just shape it as you want. So the time you spend with your gadgets, as much as possible, try to raise the gadget to your eyes rather than you going to the gadgets. That's very important, because whatever foundation you are laying now, that's what we will have for the future. So can anybody tell what this picture means? So as I told in the beginning of my session, our ancestors were with the primates, with the chimpanzees, right? We evolved from them, and they were all on the 4 pedals. And then we got modernized, we got evolved, and then we became a hunter, and then we became somebody who would farm, and then we became a builder. We would build buildings or instrumentations, and then we are back to the square one. We are glued to our screens, seated in the same postures, and we evolved from standing and being bipedal to sitting now. Now, what kind of changes our bodies undergo when we were bipedal to not even standing for a second? Our heart, our development of bones, our mental abilities, they all have changed. Now, as we are within that anterior frame of the screen, we are always sitting facing the front of our bodies to the screen. Our back channels, our sides of the ears and eyes, they are all changing for us. So at times I tell people to try to turn your body left and right, because if you're sitting in one frame, your body's ability to expand decreases. Your body ability to move to corners of the sides will decrease. 24/7 in that hours, if 12 hours you are just glued to the screen in one form, your spine will definitely become shortened on the anterior side. So you'll see a lot of postures have become like this. You know, they're curved at the back, which is called kyphosis, because your front side, which is your anterior side, is getting all shortened and tighter. And as a result, the back muscles are getting longer and very, very weaker. This is the blame on the posture or our habits of life, which has caused this. So what is the solution for it? What can we do for it? I think everybody of us who is talking about health should point out that we need to add more momentum throughout the day rather than just sitting and studying or working. Now, the simple exercises which everybody should do if they're digitally very much attached to the screens is trying to touch your eyeballs left and right, up and down. Look at the corners, diagonal and down below. This is something which every child should do every half an hour to 1 hour. If while doing these exercises you feel giddiness or dizziness, if you feel that you're feeling loss of balance, that means your spine is definitely affected. If your spine is right and you're doing these exercises, you should not feel any giddiness or dizziness. But if you're doing these exercises and you feel giddy or dizzy, your spine posture is compromised. So this is also a testing tool for any parent, any child, any teacher. If they feel that the child is not able to look up, is not able to look down, what we call is the lazy eye syndrome. So your eyeball, because of constant gazing at one pattern, it becomes stuck to the one side of the eyes. Now, the researchers have also told past 2 years, from 2020 to 2021, we have seen that people's pupil have expanded and people are not able to look up. And they're not able to look up means their vision has got reduced on the top side of our eye zone, because the vision has just reduced to the mid level. And the moment we look at the eyes up, we start to feel giddy and we start to feel a lot of, like challenges with terms to our cognitive behaviors and balance sense and proprioceptions. So we need to understand that you have to ask the child, or everybody should look up in between the classes. I would advise all teachers is come on, take a 2-minute break, look up to the fan, look up to the ceiling, go out, watch the sun, go out, watch the stars. Tomorrow's homework is count the number of stars you saw. That is the best thing to do. But what has happened? We don't connect with nature. We don't go out and look at the sun. We don't go out to look at the moon. We don't go out and look at the stars. The moment you do this, you will help to create a very good eyesight for you, vision for you, balance and posture. And the spinal growth is excellent when people do this nature watching. We call it sun gazing, moon gazing, star gazing. These were activities which we did as a child out of fun, out of curiosity. I think that curiosity is something which should be there still, and we should get out from the room, get out into the nature and observe and enjoy the nature too. It's very, very important. Now move every 2 hours. So all the child present here, whatever you love, it could be playing table tennis, it could be jogging on the spot while you are studying, or it could be doing a little bit of cycling around wherever you're possible, do a little throw, have a basketball net kept and throw into the basketball and catch it. This is a good exercise to build muscles of the shoulder and also to build the neck muscles, because all the time when you're sitting like this, the neck is the first area which our pain develops. So to build up good, strong muscles, definitely do the basketball thing. Everybody can do it. It's not like small children. Any age group can do this exercise. A fantastic exercise to build up shoulders and muscle groups. Also add in as many moments of play you can do, any kind of yoga asanas you want to do, any kind of bhujanga asanas you want to do, any kind of like walking or jogging, little movements, all of them will increase your blood circulation, because your blood gets stagnant when you're sitting for long. And a stagnant blood is the prime reason when people get a lot of disease conditions. In young girls, we see a lot of increase of PCOS and conditions like polycystic ovaries. These are all coming because we don't move. And the more movement you do, your hormones are fine, your blood circulation is good, and your spine plays a very good, important role when you move. So the sit tall, as I said, is very important. So in UK, it's recommended that kids age 5 to 15, at least 60 minutes of activity should be done throughout the day. So it's not important that the kid is just doing 60 minutes solid exercise at one go. He can divide it in a day. So in between the classes, he can just hop, jump, do some kind of, yoga asanas, short burst of exercises, and we should have an impact like running exercise. As I said, children or adults will build up muscles and bone strength only when you stand and pound onto the ground. When you do that, it's called as weight bearing exercise. The calcium, the phosphorus all gets absorbed into the bone, and that causes a lot of strengthening of the bone tissue. So the biggest pandemic which I see in the young kids now is called as the rickets. Rickets is the deficiency of the vitamin D, because the kids are not exposed to vitamin D from the sunlight. And as a result of that, they don't move, and the bones are not absorbing the calcium and the phosphorus, which is so very important, so very vital for children. So we have to engage in sending them out, stand in the sun, do some activity, and remember to sit well and sit strong. This is a very important. How many children are still going to school with their bags hanging the way it's shown in the picture? So what is wrong in the first picture and the last picture? So your bag or the school bag should be packed in a manner, the heaviest of the object in your school bag should go down, and the lightest of the object should come onto the top part of your bag. Now, if your bag has a string and it's just sloping behind and your bag is falling off, it's trying to pull you back. And when it pulls you back, it causes a lot of pain in your lower back, on your head, on your shoulders and your neck. A lot of children will complain that they have a lot of body pains coming because they went to the school and they carry a bag. The same child is carrying a bag, but the bag is very much fitted into the back of the child. It's strongly held by the strings of the bag, and the heavier things is on the downside of the bag, and the top part having a less weight object. Now, in this picture, in the second picture, you see the child is having to sit on a chair. Legs are all well grounded, supported on the chair, on the ground. But if the chair is too high and the ground is not there, we will have to encourage them to have a leg support. Because if the leg support is not there, they're sitting on in all forms on the chair, which might actually be not right for the posture. So always remember that we have to create a strong feet for these children by allowing them to run barefoot. So all the time, encourage the child to walk barefoot for some time, because the muscles of the leg, the muscles of the foot will shape the posture of the child too, because it builds proprioception and balance in the child. Now, avoid creating a dominance to keep a school bag on one side of the shoulders. And for young women and everybody who carries a carry bag, don't have it always on one side of the shoulder. The cross sling bags are always much advisable if it's not too heavy. Now, the young children are normally quite flexible also. So a lot of times we are being told that you should do yoga. So yoga is again a no-no terms for many kids who are too hypermobile and flexible. Now, during the pandemic, I see the child's hypermobility index has really gone up because of the lack of vitamin D. These childs are very, very flexible, and flexibility is good, but hypermobility is not good because it causes a lot of pain syndromes in the child. It can affect the growth of the spine. It can affect the growth of the joint of the child also. Always encourage good balance. So if children are doing scooties and all as a down figure, the child will always be propelling from one leg and one leg will be on the scooty. That causes a disbalance on the posture or disbalance in the spine. And that is what is not advisable. So if the child is doing this, try to do it only once a week, not every day, because this will cause dominance on one side of the leg, and that will shape the spine in a wrong way. So this is for everyone. Whoever is picking things from the ground, try to bend from your hip and then pick something which is heavier rather than just bending down from the spine. Majority of the cases, half of the back pains which we see in people is because of the wrong biomechanics of lifting, moving and handling. A lot of things can be changed by the way we move. So move smart and move in the right manner. I think a lot of spines can be saved by this kind of message. Why did I bring this picture in the picture? So have you seen our animal kingdom friends ever coming and visiting a physiotherapist or a hospital for neck pain and back pains? Never, right? The giraffe is tall and still going taller because it's all out and about in the natural habitat or the fields and going and doing things which he was always doing it. Now, they didn't have to worry about their posture because they never have to sit on a chair. So the same principle applies for us. We were never made to sit on a chair, but now we are sitting on a chair. So things like getting up often from the chair can do. Standing desks are a good example. So when people are taking the classes, stand and listen to the lectures, do your homework while standing, or you can sit in Padmasana on the floor. So frequent change of positions are very important for a human body, because the more you change the position is very, very good for a healthy spine. Now, I do a lot of telehealth consult for a lot of children online also. I observe the posture for the children and we look at whether the spine has got curved, whether the knees have got rotated, or there has been some kind of a curvature which is built up because of too much sitting and awkward sitting. So the prime thing which I look at in children are something called as scoliosis. Every parent, every child should be quite aware of this term called scoliosis, because we are seeing a pandemic of times when the spine is just getting curved. between the age of 6 to 12. Now, if I don't work on this child between 6 to 12, it's very difficult to change the shape of the spine without a surgical intervention or without bracing. So the key thing to remember for your child is to always make sure they're sleeping on the right bed, which is not too soft, neither too wobbly. So they're sitting in a right way on the bed. They're adding movements throughout the day. And as a family, add in movements which could be swimming, jogging, things like that, as per how the pandemic situation is. Whenever you're sitting in front of the computer, make sure you're giving plenty of lighting around your room. Many times people are going and sitting in one corner of the room. There's no plenty light around your laptops and all. That's not the right thing because your vision will change. And make sure your spine is straight and always add in a good posture hygiene to your children. The way we are telling, wash your hands, have your mask, tell them you got to get up often, have your movement toffee today, and add in as many exercises you can do throughout the day, stand up and then attend my lecture. So these are little things which can be incorporated, which can lay the foundation for us soon. Now, this is a very important topic. This is a small child. They have two triangle bones at the back. These are called scapulas. Now you see one side of the hip of the child is little more curved than the other one. Her hand, it's like having a little gap here, but a lot of gap here. This kinds of asymmetrical postures I see a lot in small children and adults also, because they never took care of themselves when they were small kids. This is called as scoliosis. Now this uneven shoulders, uneven triangle bones at the back, the spine curving, one hip is higher than the other. This is called as scoliosis. And this is an uncontrolled pandemic in the kids. Over the past 1 year, I think I see 50% of the kids have developed this because of the wrong sitting habits in the house. They sit in a couch and they sit on a sofa, which is too soft, which is also causing problems with their postures. So a lot of things can be corrected if they're sitting on the right chair and are observing the screen in the right manner too. And parents, teacher, students, they all have to bring in this education of good posture hygiene. So the important thing is all study, no play made Jack a dull boy. We all do agree with this. So practice some sporting skills, which could be in the house, which could be outside, to add in sports, because the moment you add in sports, your natural happy hormones flow. The natural happy hormones make you very, very happy to attend your classes for the further day in a nice, positive way. And your posture also gets better when you think positive. So all of you listening here, you got to do little homework today and little classwork today. So you got to stand up and try to balance on your single toe here today. Try and see if you're able to balance yourself only on the toe of your legs. If you're able to do it, your postures are very good. And try to do this homework. Yeah. Come on. Athar, yeah, I'm seeing you. Excellent.
मैम एक ही टो पे करना है या सारे टो
एक ही टो पे करना है, एक ही टो पे.
ओके मैम.
आप देखो दोनों हाथ को, you fly like a bird and one leg is up in the air. Try to balance on one single toe. Yeah? Good, good, good. Awesome, awesome. Yeah? Good. Now the next one is try to stand and imagine there's a staircase. Climb the staircase. High march. So whatever I'm talking today can be incorporated on a daily basis. All the kids can do the same thing every day in between your classes. It's a very good way to get blood circulation and the postures in a right way. And now move around the room. Come on, go jog around the room, all of you. Go around the room. Yeah? Very good. So yes, so that's the posture workshops we do. If you see here, the child is asked to do a W. So this is a very good exercise whereby you can put your hands Imagine you're putting it like a W. Make a W with your hands. This is a good exercise to open up the chest and to take away all the fatigue which is built up over the days of constantly sitting and stooping. Another exercise is keeping a book on your head. So everybody keep a book and balance it on your head. It gives you a right posture for your neck, for your head position. You see how the kid is walking with the book also now. Balance and walk. All of you walk with the book on your head and see if the book is not falling. So these are two tips which I give to every child. You should definitely do it every day. Very good, very good. Excellent. All right. So now we are open for questions, everybody. Thank you for listening.
Children, you can ask your questions now. Anybody has any questions, please raise your hands. Oh, that's strange.
No questions
Yes.
today?
Yes, Dr. Anjali ji.
All right, we have, sorry.
मैम जैसे आप बोल रहे थे कि खड़े खड़े एक क्लास वर्क या होमवर्क करना चाहिए मैम, कभी कभी मैं क्लास के बीच में खड़ा हो जाता हूँ और अपना क्लास का काम करने लगता हूँ.
Excellent. Very good. Very good.
Very good.
We have Varun. Varun, can you unmute yourself, please, Varun? Unmute. You want to ask a
Unmute.
question? Sorry, that's Aryant. Varun is still. Varun, can you please ask your question?
I think he's not able to unmute.
Yes, Dr. Anjali ji.
Yeah.
Shall I ask some question?
Yeah.
Yes, please
Yes.
go ahead.
Yes, Dr. Anjali ji actually learned so many things through your wisdom, especially that eyeball exercise. I loved it. And see, my sitting hours is more than 3 to 4 hours, right? So that I'm getting very back pain, especially. So what I have to do? I cannot escape from this sitting because you know about our work. Okay, so that is a 3 to 4 hours long hours we are sitting on the chair. So what I have to do to avoid that situation?
So as I said, 2 simple exercises like making a W.
Yeah.
Try to pull yourself as much as possible in between your work, right?
Okay,
so
fine.
it's even if you're not able to stand, even if you're not able to go out and do any movements, just sitting on a chair, try to move your elbows and hands back. So when you do this, you open up the chest. Basically, what's the issue is, as I said, the front side of our body gets tightened and it gets shortened because of constant sitting. So we really need to expand it. So how do we do it? Kind of pull your hands back. That's a good way to kind of energize your body with good oxygen too. So take in a very deep breath when you do this and kind of breathe out. Okay. So immediately when you do this, you'll see fresh leaves of life has come into you, right? That's a positive energy which you fill in with. Yeah.
And even you taught us so many exercise. We can do exercise through online also even. So definitely, thank you so much. We learned so many things.
Thank you.
Definitely we will do it.
Thank you.
Dr. Anjali, here I am with a question. I mean, see, in the DLDAV Pithampura, Delhi, our principal madam is very, very keen that along with the academics, we have to have a lot of stress on the physical activities, be it sports or in other forms, right? But as a reminder, I would like if you can share some of the videos so that it keeps on reminding us on day-to-day basis. If we show those videos to children, even to the teachers on daily basis, that acts as a reminder to us that how we have to sit and how important it is, impertinent this is, in today's times, so that we are having right movements, we are having good postures. So kindly, if it is possible, some videos can be shared because most of the students may not be present in this session. So it will be beneficial for all of them.
Right. I think I can send it out to Mr. Ashish, and from there we can connect, right?
Oh, no. Sure. Thank you.
In fact, I was just looking at the chat and there are a couple of people who have really requested for this session, if it is being recorded, to be sent to them. So I believe this is on YouTube and it can be
Yes,
accessed.
yes.
Sapna, is that
Okay.
correct?
Right.
Yes.
Yes, sir. Yes, sir.
Yes. So anybody who's looking to kind of forward this, because I saw some people want to forward it to their family, some people want to relook at it.
I will send.
So it can be accessed on YouTube. Okay,
Right.
I think we have Arihant over here. We are running out of time, but we have a couple of quick questions. Arihant, you want to just unmute and ask your question? Arihant?
Good evening, ma'am.
Good evening.
Good evening, ma'am. My
Good evening.
question is how frequently good evening, ma'am. My question is how frequently we should give rest to our backbone and eye while using a laptop.
So you should ideally give every 30 to 20 minutes. Okay. So every 30 to 20 minutes, imagine you're looking up to the sky, which is your stars, your moon, and your sun, and try to get up and try to jog around. As I told you, that exercise where you're imagining your stair climbing, you're kind of jogging, do that. So when you do that, you'll see your performance in your studies will also go up. Right?
We have
it is raining
Varun
now.
over here. Varun, would you like to ask a question?
Am I audible clearly now?
Yes.
Thank you so much, Ashish ji and Anjali ma'am, for this wonderful session. I must say, honestly, the last half an hour, each and every word and each every sentence made a sense. It was so informative. And my question is, I am a software engineer for last 15 years, and 2 years back, I was diagnosed with sciatica. So after that, there was no issue. 2-3 times it pained a lot, but after that, it didn't. So should I take precautions, or because at least 8 to 9 hours I'm on my chair and working on the laptops. So that is one thing. Second question is, what should be the angle? I mean, at what height your table should be placed and what angle should we have from the eye to the laptop? So because
So you saw my session where I showed the picture of the gentleman sitting in front of the computer, right? So angle should be about 10 to 15 degree of your eye lobe to your screen, basically, and the 90-90 degree rule, where your shoulder to elbow to your wrist and to your hip to your knee and to your ankle should be 90 degree. So basically you're sitting just like a chair. You're just sitting like a chair pose. So also a sciatica is something which happens because you're continuously sitting on the sciatic nerve. So your sciatic nerve is also passing from the hip area. So when you're seated for long hours, the sciatic nerves gets compressed. And sometimes we call it piriformis syndrome, which is causing sciatica. So we really need to differentiate whether the sciatica is coming from the intervertebral disc being compressed, or it's coming from the piriformis, which is a muscle in the butt, which gets inflamed because of constant sitting. Many times gentlemen use a wallet and put a wallet in the back pocket and they sit on it. That is again aggravating factor for sciatica in many gentlemen. Luckily, women also have this pain mainly because they sit in a cross-leg manner. So never try to cross your leg when you're sitting. Always have your legs in a right distance and only at 90 degree.
okay,
Thank you.
ma'am.
Okay, are there any other questions? I think let's let this be the last question. Advik?
Just one thing I would like to ask Dr. Anjali. It's been a very enriching session. Generally, I mean, we have seen that tall people face a lot more problems, I mean, regarding the spine. So, I mean, these spinal issues which keep coming in, what is, I mean, any particular reason as such, or, I mean, would you like to throw some light on this particular aspect?
You see, tall people, everything which has been designed in the house ergonomically has been thought about a normal height range. People who are very tall will have to sit on a bed which may be for somebody who's at a actual height or a normal height level. But when he has to bend down, he has to bend at a very greater angle for the spine to move at a certain angle. That causes a lot of shear tear in the ligaments of the joints. So things which are on the ground level, for a person who is tall, he always has to multiple times bend down. All your flats and all your homes are designed in a particular manner for a particular person, whether it's your washing sink or a wash basin, anything for that matter, your dining table height, anything has been designed one common person in manner, and that's how it's been evolved and designed. So I would advise that your bed height for somebody who's very tall should be ideally for his height level, not designed in a way that is too low. So furniture, ergonomic furniture is something which is very important. So when you have your sofas, it shouldn't be too low. It should be at a height where, as I said, 90 degree. So for you, Mr. Charu, for Mr. Ashish, for Mrs. Arunas, everybody's heights are different. So when you sit on a chair, you should know your 90 degree, which is with the ground. So anybody who's tall, his level of 90 degrees is different than yours. So that's how his chair, his bed, everything should be designed according to it. And I know it's difficult for them to have a wash basin which is not too low. So what they should imagine is to bend from the hip rather than bending from the spine. Two things to keep in mind is bend from the hip, never to bend from the spine. And it's easy to get things done from the, the top shelf for them. That's one blessing for them, but things to do on the ground is difficult for them.
I think we are actually running out of time, but I have Riddhi over here. She wants to ask a question. Riddhi, you want to ask your question? Let this be the last question that we have. Riddhi, are you there? All right, I think she's not there anymore. So anyway, we'd like to conclude this session. But before we conclude for the day, I would like to ask Mrs. Ritu Mahajan to just give a vote of thanks.
Thank you, Ashish sir. On behalf of all those who are present today, I would like to report my heartfelt appreciation and gratitude to Dr. K.K. Agarwal Heart Lung Care Foundation for its tireless efforts in sensitizing the community about pertinent issues through enriching webinars and interactive sessions. I would particularly like to thank Dr. Anjali Agarwal, an eminent consultant, physiotherapist, lifestyle consultant, advocacy co-director, long COVID physio, for very, very enlightening, informative session. Besides the immediate effects of COVID pandemic, what is being realized is the long-term adverse consequences that are following the virus. It is very important today that we are aware of the repercussions in time, and we are also simultaneously motivated to make the subsequent changes in our lifestyle. Thank you, Dr. Anjali, for your informative talk. I would also like to thank all the participants, the little children and viewers, for their patient participation in the event. I am hopeful that we shall be abiding by and adhering to the tips that our illustrious speaker has given us today, and we'll put them certainly into practice. Once again, I heartfelt my gratitude and appreciation to Dr. Anjali Agarwal's session. And thank you, K.K. Agarwal Sir's Heart and Lung Care Foundation for organizing such webinars. Thank you so much.
Thank you, ma'am. Thank you so much. And I think that's been an absolutely wonderful session. Thank you so much, Dr. Anjali. I truly believe that this information is going to go far with the children.
Sir, my special thanks to Sapna ji for organizing such a wonderful session. So thank you, everyone. Thank you.